Dr. Purushottam sir to welcome our speaker with a sapling. I request sir to kindly be seated. Ayurveda academician, clinician, researcher, author, administrator, and public health expert with an illustrious career spanning more than 2 decades. Born in 1973, he completed his BAMS level with gold medal. He pursued his first postgraduate degree in Kaya Chikitsa from the University of Kerala in 2000. He later completed a second postgraduate degree in Roganidana from Kannur University in 2008 and was awarded a PhD by the University of Kerala in the year 2019. Dr. Gopakumar sir has over 21 years of teaching experience and has served in various academic positions across reputed institutions. He is presently the Registrar of Kerala University of Health Sciences, Thrissur. He has served as PG and PhD guide, examiner for undergraduate and postgraduate courses, subject expert for PhD synopsis scrutiny, and as a member of inspection and governing bodies of the university. He is also actively involved in the International Research Institute of Ayurveda in various academic and monitoring capacities. Dr. Gopakumar is a nationally and internationally recognized scholar, having delivered invited lectures and scientific presentations at several prestigious forums, including presentations at the British Parliament, London, the Nehru Centre High Commission of India, London, and International Scientific Synopsis in Bangkok. He has played a pivotal leadership role in Ayurveda-based COVID-19 response activities in Kerala, serving as chairman of the Regional Ayurveda COVID Response Cell and coordinating Ayurraksha clinics, awareness programs and medical camps. A prolific author and editor, Dr. Gopakumar has published numerous textbooks, clinical monographs, edited volumes, many of which are widely used by Ayurveda students and practitioners across India. He has also published several scientific articles in Ayurveda journals and magazines and is a regular contributor to television and radio programs on Ayurveda and public health. His contribution to Ayurveda education, research, public health and academic leadership have been recognized through numerous prestigious awards like Dhanvantari Ayurveda Puraskara, Bishag Ratna Award, Aturamrita, Best Teacher Ayurveda Teacher Award instituted by the Ministry of Ayush, Government of India, along with several national and state level honors. In addition to his academic excellence, he has demonstrated remarkable achievements in art and literature, representing Kerala at the World Malayalam Conference in Germany and has contributing extensively to Malayalam literary publications. Dr. Gopakumar has also rendered exemplary service through the National Service Scheme, having served as Program Officer, State Team Leader and a recipient of Best Program Officer Awards at both state and national levels. With his rare blend of academic scholarship, clinical expertise, administrative acumen, cultural sensitivity, and public service, Dr. Gopakumar S. stands as an inspiring figure in contemporary Ayurveda. We are deeply honored to have him here with us today as a resource person, and we look forward for his scholarly deliberations and valuable contributions to this conference. Sir, over to you.
Until and unless the clinician is not entering into the clinical consciousness of the patient, he is not going to be a successful clinician. Rogamadu Parisheda Padanandara Maushadam. So that is what I am telling. And every time a right move at the right time will make you and your patient happy. So you should be able to identify the entire pathological scenario behind the diagnosis. That is my humble conclusion. Next slide, please. And whatever be the disease, whether the disease is coming under oncology, whether the disease is coming under neurology, whether it is an endocrine pathology, ultimately every change will be occurring in a cell. The ultimate component of disease production is a cell. In Ayurveda, we may call it as Paramanu. So whatever be the changes we explain in Ayurveda, homeopathy, Unani, in any system of medicine, every pathological changes are manifesting in a cell. So my belief is how you can see the cell, how you can feel the cell, how you can visualize the cell using any scientific advancement or any technological advancement will help you. I will tell you one example. You are getting a case of carpal tunnel syndrome. I think everybody know what is carpal tunnel syndrome. And carpal tunnel syndrome is a condition where the median nerve is entrapped in the flexor retinaculum and the patient will be coming with numbness. The patient will be coming with the pain and they will be having that tingling sensation. According to Ayurveda, you may call it as shula, pain, supti, numbness, and the patient will be always having problem in the wrist. And it is very common in diabetes mellitus, hypothyroidism, as well as in rheumatoid arthritis. The problem is, if you are able to measure the nerve conduction velocity using the NCV study, then you can tell how fastly you can decide the treatment. When you are getting a case of carpal tunnel syndrome, my dear students, please go with the nerve conduction velocity study. Then you will be seeing that the movement of Vata. According to Ayurveda, the principal dosha for all movements in the body is Vata. The circulation of the blood through the vessel is Vata. The transmission of the impulse through the nerve is Vata. And the secretion of the thyroid hormones and entering into the bloodstream is Vata, because Vayu Chala Guna. So when you are having nerve conduction velocity study, you are measuring the Chala Guna of Vata. Then you are going to apply. And whenever there is slow movement of the nerves, slow movement of the nerve transmission, we are calling it as very slow nerve conduction velocity. It is Manda Guna. It is Manda Guna of Kapha Dosha. And Kapha Dosha, Vada share the common property, Shita Gunam. Yes, Stampane Shaktisa, Shida. Opposite of Shida is Ushna. So we will advise an Ubanaga Sweda in the wrist joint. That is the conclusion. You are administering one Upanaka Sweda in the joint, in the wrist joint, by which you are getting a decongestive effect, and that can be proven by the nerve conduction velocity. So, from the simple clinical feature to the advanced modern diagnosis, then to the right classical treatment, then the right assessment, this is what I am telling. I think this is very much understandable to you. So, every time when you are talking about a pathology, imagine a cell. What is happening in a nephron? What is happening in a neuron? What is happening in a dermatocyte? What is happening in hepatocyte? What is happening in RBC? What is happening in WBC? What is happening in platelet? This cellular level application of fundamentals of all the systems of medicine is very, very, very important. I will tell you, according to Ayurveda, when Pitta dosha with the Ushna Tishna property is working in the Rakta Dhatu blood and destroying the thrombocyte, you are getting hemorrhage. You are getting a disease called dengue hemorrhagic syndrome. You are getting dengue fever. In dengue fever, you are getting definitely the problem with Rakta Dhatu blood, but in a particular stage, the thrombocytopenia, the massive reduction in the number of platelets will be leading to hemorrhagic syndrome. Then please identify the Ukshna, Tikshna, Guna or Pitta dosha is damaging the thrombocyte, the Kapha component responsible for clotting. We very well know without Kapha dosha, there is no clotting, because clotting is the process of combining the tissue together, slish alingane. So when you measure thrombocytopenia, you are measuring the Kaphaja component responsible for skannatvam in the recta. I am telling 2-3 examples by which you will be having a very normal thought process. So follow me in the next slides. Next. Cell injury is defined as a variety of stresses a cell encounters as a result of changes in its internal and external environment. My dear friends, I would like to introduce the term cell injury. According to modern medicine, whatever be the clinical pathology, every event starts with the cell injury. What do you mean by cell injury? Cell injury means the challenge, the threat faced by a cell by multiple external factors. So I would like to tell you, in Ayurveda, there is a concept called Agandu Nidana. In Ayurveda, there is a concept called Agantu Nidana, and Agantu Nidanas are very much comparable with cell injury in modern medicine. I will tell you, E Bhuda Visha Vayu Agni Kshada Bhangadi Sambhavaha Kama Krodha Bhayadyascha Tesu Ragandavo Gada. What is the simple meaning? According to modern medicine, ischemia, any type of microorganisms, any climatic change, any immunological challenge, any stress will be damaging a cell. The simple concept is mentioned as Agantu Nidana. So my humble point is, you are measuring the level of cell injury caused by the vitiation of Tridosha or any other factor by doing the investigation. My dear students, please make it clear, when you are measuring a particular component like RBC count, WBC count, or you are measuring ESR, or you are measuring CRP, you are going to measure the impact on a cell by external factors. I will tell a simple example. Everybody know what is fatty liver. Everybody know what is fatty liver. In fatty liver, there is excessive deposition of fat in the liver cell called hepatocyte. The normal liver cell is called hepatocyte, and excessive accumulation of the fat in the hepatocyte is called fatty cell as per modern pathology. According to Ayurveda, there is a dosha called kapha with the snigdha guna. There is a dhatu called medas with the snigdha guna. So kapha, medo, dushti in pitta sthanam is fatty liver, because liver is pitta sthanam, and we very well know shonida vahanam srodasam yagurt moolam plihaja. So wherever you are getting a fatty liver, the point is you are getting kapha, medo, dushti in pitta sthanam. Then what is the benefit? What is the benefit? Because if you open the Charaka Samhita, Ashtanga Hridaya, there is no chapter called Adada Fatty Liver Namadhyayam Vyakyasyamaha. There is no chapter called NASH. There is no chapter called ASH. So when you are getting the picture of fatty liver by ultrasound, or when you are getting the improper liver function test, what is the clinical conclusion? You are identifying that in the liver cell, kapha medo dushti and kapha medo dushti in pitta sthanam. So take a medicine which is against kapha meda, that is varanadi, and take a medicine which will work in liver, that is padoladi. Then add with a medicine which is having strong impact on the medo dushti, triphala gugulu. So what is the clinical outcome? You are going to prescribe Padoladi Kashayam plus Varanadi Kashayam with Triphala Gugulu in fatty liver. That is only after measuring the fat deposition in the liver cells hepatocyte by modern investigation. I think you are getting me. So this is the way how to approach the modern clinical investigations in Ayurveda. So the finally 2-3 points are there. Cellular response to stress varies from type of cell and extent and type of cell injury. So only one word, the Rucha, Legu, Khara, Tishna, whatever properties are told in modern medicine, they will be creating a change in a cell, and those changes are measured by modern medicine. That is what I am telling. I will tell another case. You are getting hypothyroidism. In hypothyroidism, you are getting less secretion of the T3, T4. On the other side, you are getting hyperthyroidism, where you are getting excessive T3, T4. What is the concept in Ayurveda? When you are getting less secretion of T3, T4, your Dhadugada Agni is low, because thyroid hormones are excellently performing the function of basic metabolic rate, BMR. Basic metabolic rate is nothing other than equivalent to the functions of Dhatogni. So when Dhatogni is coming down, it is Kapham. When Dhatogni is going up, it is Tishnam. So Kapha Vada spectrum with Manda Gunam, that is hypothyroidism, and Pitta Vada spectrum with Tishna Gunam, that is hyperthyroidism. So when you measure the TSH, when you measure T3, when you measure T4, you are exactly studying the status of Dhatogni. So this is what I am telling. By seeing the modern investigations, you will be able to interpret the status of Dhatogni in hyperthyroidism and hypothyroidism. So this is the way to think forward. Every clinical picture mentioned in the oldest medical sciences can be updated and further taken with the help of advanced technological scientific investigations that is to be in your brain. That is why beautifully Susruta told, Egam Shastra Madiyano na Vidyan Shastra Nishchayam Tasmat Begustruda Shastram Vijaniyat Chigilsaga. Next. Now you see why and where modern laboratory investigations. I have 3 reasons to tell before you. To get the micropathology, to get the nature of the progression, for the better understanding of disease process. I will tell another example. Say for example, when you are getting raised serum uric acid level, we very well know serum uric acid is the byproduct of purine protein metabolism. Purine protein metabolism, the normal value of serum uric acid may be 6 milligram. When it is raised, we will call it as gout arthritis. Everybody know gout arthritis. Listen carefully. When there is increase of the serum uric acid, after a particular level, it will go to the big toe and it will deposit there, then you are getting gout arthritis. But what is the value of measuring the serum uric acid? The serum uric acid can go further to the kidney. That is what is beautifully called in Ayurveda, Vimarga Gamanam. Such terminologies we study in Ayurvedic fundamentals, we never use in practice. I am telling you, the serum uric acid crystals are needle-shaped crystals which are deposited in the big toe, and then it will be leading to an inflammation. But if you are not treating it properly, if you are not controlling the serum uric acid properly, it will go to the kidney where it will be leading to uric acid stone, uric acid crystal. So what is the benefit to an Ayush doctor? Once the Ayush doctor know that the serum uric acid is gradually accumulating in the blood, you are not removing it by Virejana, you are not removing it by any other medicine, it will go to another place called Sthana Samsarayam Vimarga Gamanam, then in the kidney, which will be leading to Paithigashmari, which can even lead to renal damage. So the right investigation in the right time, using the right fundamental concept of the Ayush system, will be preventing the future issues. That is the beautiful advancement of knowing modern investigation. So for better understanding of disease process, this is very important. I will tell another example. I am telling only example. You are getting an acute rheumatoid arthritis. You are getting an acute rheumatoid arthritis, and there you will be getting high ESR, high level of C-reactive protein, and there may be even RA factor positive. But if you are not identifying it properly and you are only relying upon the analgesic, the arthritis will proceed. Finally, there will be irreversible deformity. I am using the word irreversible deformity. So the irreversible deformities can be prevented not by a painkiller but by a classical biopurification like Panchakarma, Madhutailika Vasti and Rasayana Vardhamana Vipali Prayogam. That is why if you know the progression of the pathology, you may be able to prevent it, by which you can avoid the irreversible cell injury. That is the most beautiful advantage of Ayurveda and modern investigation. You can prevent the irreversible progressive cell injury if you diagnose at the right time. Next slide, please. So the question is how current lab investigations can help in identifying and assessing the Samprapti factors with more accuracy. I will tell you one more example. When you are getting trigeminal neuralgia, all the cases whatever I am telling are treated by me only. When you are getting trigeminal neuralgia, you are having the clinical spectrum, but when you identify the symptomatology and you are doing the Nasya Karma with the Vadapitta Samana drugs like Shirabala, and you are doing Gendusha Karma, and you are doing the Shirodhara, and you are giving the medicines which are working on the Varanadi Kashayam like Shirashula, and rightly measured by the modern diagnosis can only prevent. Otherwise, trigeminal neuralgia will be just like a Shirashula. That is what I am telling. You are having the maxillary division, mandibular division and ophthalmic division of the trigeminal nerve. Until and unless you know it is due to the trigeminal nerve, you will consider it as an ordinary Shirashula which may not be able to controlled in the later stages. So know the Samprapti. What is Samprapti? Samprapti is the written screenplay of a disease. I am telling you, if the disease is a movie, the written screenplay of the movie is Samprapti Vigatanameva Chikilsa. So identify the Samprapti by most sophisticated modern investigation. That is the need of the hour. Next. So dosha dushya sammorchana versus lab investigation. If you are an Ayurvedic doctor, I know homeo doctors are there, they will be also having their own fundamental principle. Whatever may be, the action between the dosha, dushya in the particular site is disease. We call it by a single term, dosha dushya sammorchana. What is osteoarthritis? In osteoarthritis, the aggravated vata is localizing in a knee joint and destroying the cartilages of the bones of the knee joint, then you are getting Sandhigata Vadam. The patient will find it very difficult to climb the steps. The patient may not be able to sit in the floor. Then identify Vatapurna Dhrivisparsham Shobham Sandhigado Anilaha Prasarana Kunchanayo Pravarti Savedana, which can be beautifully measured by the imaging technology. You will be getting the X-ray, which will be telling that the articulating ends of the bone are getting damaged. Then what you will prescribe? You will take the pen and write Gandha Thailam, Laksha Gugulu, Kedagi Muladi Thailam, Sudha Vargam, which will be improving the Karaguna of the Vata in Asti. The Karaguna represents the calcium content of the bone, and when you are empowering the Karagunam with the medicines like Laksha Gugulu or the medicines like Gandha Thaila, you are treating the osteoarthritis. And definitely you can assess the progression of the disease by the imaging technology. I will tell another disease. We are getting inflammatory bowel disease, IBD. We are getting ulcerative colitis. We are getting Crohn's disease. I think you may be knowing the two conditions called ulcerative colitis and Crohn's disease. And we used to do Pichavasti. I think most of you know what is Pichavasti. In Pichavasti, you are using the materials which are healing the intestinal mucosal erosion. So you can measure the progression of the ulcerative colitis management by using the Vastikarma and colonoscopy, because both are working in Pakvashaya. So this is what I am telling. Clinical confirmation, laboratory confirmation, both when merged together will be getting a clear picture about the disease progression as well as disease pacification. Next slide. So lab investigations reflect the status of Dhatu Sara. This is a very beautiful point. The Dhatu Sara, according to Ayurveda and even by other conventional systems of medicine, Dhatu represents tissues. Dhatu represents tissue. So Dhatu Sara means the essence of the tissue, the vitality of the tissue. I will tell one single example. When you are getting SLE, systemic lupus erythematosus, I think most of you know what is SLE, systemic lupus erythematosus, which is a multi-system involving autoimmune disease. Multi-system involving autoimmune disease, where you are going to get the problems in leukopenia. You are getting the reduction of WBC, you are getting anemia, you are getting the reduction of the RBC, and you are getting the reduction of the thrombocytes. All the three major components are getting down. That itself is showing that there is Rakta Sara Heenata. So my dear friends, reduction in RBC, reduction in WBC, reduction in thrombocyte is nothing other than Rakta Sara Heenata, which may come under the Pandu spectrum. Then according to the dominant tissue problem, select Kalyanaka Girda, Dadimadi Girda, Panchadikta Girda, and go for other Chikilsa. So that is what I am telling. Most of the modern investigations are reflecting the Dhatu Saram. Say for example, in osteoporosis, in Asti Saushirium, you are getting the decline of the bone mineral density, and the bone cells are becoming weaker and weaker. And in demyelinating disease like multiple sclerosis and Guillain-Barré syndrome, you are getting the problem in the nervous tissue. So every time a particular tissue, if it is weakened by external pathology, that is what is called Dhatu Sara Hani. And most of the modern investigations are reflecting the Dhatu Sara Hani only. Next. So this is very normal, everybody know. Next. And now you know chronic myeloid leukemia, you are getting the increase in number, Rekta Vriddhi. Charaga beautifully told a concept in Rekta Vitta, Vriddhi Adhigachadi. So Rekta Vriddhi by a particular term can be interpreted as leukemia, so that when you get the picture of CML by a bloodstream, you will be able to apply the treatments mentioned in Rekta Vitta for CML. That is why in the initial stage, Vasha Guduchiadi Kashayam is applied. What is Vasha Guduchiadi? Vasha Guduji Triphala Kaddi Bhunimba Nimbajaha Kodaka Shaudra Ido Handi Pantu Pittasra Kamala. The administration of Vrishagrida. The Vrishagrida is the sole product of Adathoda vasica, which is given in the early phases of leukemia simply because the Rekta Vriddhi told in Rekta Pittam and chronic myeloid leukemia are interconnected. That is the connection between classical science and modern investigations. Next.
then Schulman syndrome. There are so many pathologies. A very rare condition. It is characterized by inflammation of tough band of fibrous tissue sheath beneath the skin. Inflammation is caused by abnormal accumulation of eosinophil. Why I showed this particular example? Because when the eosinophil count is increased, you are getting skin manifestation. Normally, we will generally tell Rakta Dushti and skin manifestation, but this is a rare condition where you are getting eosinophil count increase, initial symptoms include pain and swelling and inflammation of the skin. Now, please see the picture. Next slide. You can see this is the condition. So, when you are getting this condition with the fibrous thickening of the skin, then you will identify that it is not a simple condition of Rakta Dushti, it is hypereosinophilia. That is why a particular component of blood is investigated to connect with a modern dermatological pathology. So only when you know both the signs of in an equal way, you will be able to treat it. Next. Then hematocrit or PCV, everybody know packed cell volume, amount of packed red blood cells. This measurement depends on the number of red blood cells and the size of the RBC. Next slide. You can see the normal values, male 42 to 52%, female 36 to 48%. So packed cell volume represents different clinical conditions with precise accuracy. Next. Then reticulocyte, we very often talk about reticulocytes in dengue conditions and hemorrhagic features. Reticulocytes are juvenile red cells that pass into the bloodstream from bone marrow. They stay in circulation for about 24 hours. As red cells mature, they lose their nuclei and accumulate. So reticulocyte count and RBC are very, very closer. Next. Next. So normal value 0.2 to 2%, infants 2 to 6%. Only when you know the reticulocyte value, you can predict the status of the RBC count. Next. Next. See, repeated absence or low counts of the reticulocytes indicate bone marrow suppression, which may be the cause behind aplastic anemia. That is the point. Even before you are going to get the count of the RBC, please check with the reticulocyte. A repeated absence, that is important. A repeated absence of the low counts of the reticulocytes may indicate aplastic anemia. You have to treat Rakta Dhatu plus Majja Dhatu. That is the point. Otherwise, we can limit the treatment only to the Rakta Dhatu, Majja Dhatu, Rakta Dhatu, both are to be connected. The very common drug is Tiktaka Gridam. Because Tiktaka Rasa, Tikta Gridas are very, very applicable in Pitta Rakta spectrum, and Grida Kalpana with Tikta Rasa is very much applicable in Majja Dushti. So in aplastic anemia, think about Tiktaka. That is why beautifully Vagbada told Pandovamai Pibedado Sarpur Kalyanaga Huyam Panjadiktam Kalyanagam Mahadiktam Panjagam. So all the Tiktaka Rasa drugs are important in not only Pandu but also in Majja Dhatu. So when you are getting a low reticulocyte count indicating Majja Dhatu depletion, think about Tiktaka Grida. So diagnostic level, management level, these inputs from the modern laboratory investigations will definitely help you to go further with a confident steps. Next. Next. This already we told. Then lab investigations in major Dhatu related pathology. This is very, very important. Very, very important. My dear friends, in most of the condition, all the pathologies will be limited to 3 stages. Dhatu Mala Sanchayam, the unwanted accumulation of metabolic products, that is Kaphajam. Dhatu Mala Sanchayam. Then Dhatu Pagam, there will be multiple level inflammations, maybe due to even autoimmune, Dhatu Pagam. And finally, there will be tissue depletion, Dhatu Shayam. So there are 3 important systemic pathology according to the classical wisdom. Dhatu Mala Sanchayam Kapham, treatment is Langhanam. Dhatu Pagam, Pitta Pradhanam, treatment is Gridabhanam, and Dhatu Shayam, Vada Pradhanam, treatment is Brahmanam, Bellium, Rasayanam. So different investigations will tell you the pathology may be Dhatu Mala Sanchayam, then Dhatu Pagam, then Dhatu Shayam. Typical example, think about fatty liver. Think about fatty liver, Dhatu Mala Sanchayam. Medo Dushti, Medo Vrdi. Then Dadu Pagam, alcoholic steatohepatitis, non-alcoholic steatohepatitis, Dadu Pagam, Pitta Pradhanam. And finally, Dadu Shayam, the liver will be totally converted into a secretory stage with the liver cirrhosis. So what I am telling, fatty liver to the hepatitis condition, and finally the destruction of the liver cirrhosis. So Kapha to Pitta to Vada can be easily measured by modern diagnostic methods. This is what I am telling. When you are getting a typical diabetes mellitus, the acute diabetes mellitus with the type 2 diabetes, with the insulin resistance as the major component, Kapham. Then you are getting the Rekta Dushti, all the vascular phenomenon, the vessel problem, the bleeding issue, the gangrene issue, everything coming under Pitta. And finally you are getting diabetic neuropathy, diabetic amyotrophy, Mamsa Shosham, Sira Shosham, and that is Vadigam. That is what is beautifully told, Kale Noveshidam Yasma Sarvam Yadi Madhumekadam. So the measurement of Kapha domination, the measurement of Pitta domination, the measurement of Vada domination can be clinically assessed as well as by the modern laboratory investigation. Next. So this is what I told earlier, fatty liver, Pitta Sthanam, Yagarat, Kapha Medo Dushti. So when you are getting an ultrasound of fatty liver, you will be able to proceed with the Kapha Medo Chikilsa in Pitta Sthanam. Next. And you can see the first picture, healthy liver and fatty liver, and chronic pancreatitis, healthy pancreatitis, and Parkinson's disease. In Parkinson's, when you are getting the modern diagnosis, you will be getting the reduction of the dopaminergic neuron in the substantia nigra. But initially, my dear friends, initially in Parkinsonism, there will be an element of avarana, and then only it will be converted into dadushaya. So never believe that all neurological diseases are simply dadushayam. No. Even the degenerative conditions like motor neuron disease or even Parkinsonism, they start with avarana, then only will be leading to dadushaya. So avarana can be considered as any problem where there is a obstruction. Avarano margasya roda. The inhibition. My dear students, please listen. The inhibition, the suppression, the stagnation, the delaying, the relaying, or the common pooling, cooling, everything which will slow down a particular physiological activity is called avaranam. Inhibition is avaranam, suppression is avaranam, obstruction is avaranam, delaying is avaranam, retardation is avaranam, stagnation is avaranam, cooling is avaranam, pooling is avaranam. That is why avarana will depress the pathology, depress the physiology in the first stage, but finally it will become dadushaya. So Charaga beautifully told all avaranas will be leading to dadushaya. Avarana can be measured by the modern investigation, and dadushaya can also be measured if it is avarana stage. Apply Uddvartana, Ruksha Chikilsa in stroke. You are getting ischemic stroke and you are getting hemorrhagic stroke. When you are getting a cerebrovascular accident like a thrombus, embolism, you are getting avarana. You will never ever apply Shastika Shali. You will never ever apply Brahmana Sneha like Ashwagandha. But whenever there is avarana, you will apply Ruksha Seda, you will apply Uddvartana, and you will apply Lekhaniya Vasti. But when it is coming to the dadushaya stage, you will think about Brahmana Chikilsa. Naturally, your pen will be taken and written Vidaryadi Gurdam Vigas, Vidaryadi Rayam Hridyo, Brahmano Vada Pittaka, Shosha. Gulma Anga Marda Urda Shosaka Sakarogana. My dear friends, the differentiation between upper motor neuron and lower motor neuron you can use in Ayurveda. In lower motor neuron lesion only you are getting the muscular atrophy, the muscle weakness, the muscular dystrophy. Shosham is seen in lower motor neuron lesion, and that is why LMN you are considering Mamsa Shosham, then prescribing Vidaryadi Girdam. Vidaryadi Girda will be never prescribed in an avarana stage. That is the beauty of the modern investigations. Next, already we discussed the fatty liver. You can see the first picture and the second picture. Very big fatty globules are there, telling that Medo Dushti in Pitta Sthanam. The second white spots are the fatty globules. Next. And you can see in the ultrasound normal, moderate fatty liver and severe fatty liver. What is the third picture? There is diffuse collection of the fat. The Medo Dushti Dushti can be visualized by extended Pratyaksha Pramana. According to our old Acharya, they told about Pratyaksham, Anumanam, Aptobadesham, Yukti. These are the extended Pratyaksha. The Pratyaksha which cannot be seen by the Mamsa Chashus can be seen by a better scientific advancement. So the first and third picture shows diffuse fatty accumulation, and the previous slide showed about the accumulation of the fatty globules. This is what is happening by modern investigation. So what you will do when you are getting that from the first picture to the second picture to the third picture, you can see the damage of the dhadus are getting more and more. Then definitely you will take the powerful weapon as Rasayanam. You will think about Sharabunga Rasayanam. You will think about Vardhamana Vipali Rasayanam. When you identify that, it is passing from moderate to severe stage of fatty liver. Next. Again the same picture. Next. See thyroid disease. Next. Next. See, this is the problem I told you. When you see the internal thyroid follicle, you can identify how much T3 and T4 is there. When excessive, listen carefully for a minute, excessive T3, T4, you are getting Ati Tikshna property. The body weight will be lost, the mood changes will be there, heat intolerance. In hyperthyroidism, heat intolerance, and in hypothyroidism, cold intolerance. My dear friends, let us go to Charaka Samhita. Beautifully told two types of jara, Dahadi Joram, Shitadi Joram. In Dahadi Joram, you cannot tolerate the heat. In Shitadi Joram, you cannot tolerate the cold. So hyper and hypothyroidism can be measured by the modern hormones, and then you can apply the concept of Dahadi, Shitadi. The rasayanas like Amalagi, Guduji, Ashwagandha, Shatavari. I repeat. The rasayanas like Amalagi, Guduji, Ashwagandha, Sadavari are applicable in hyperthyroidism, Pitta Shamanam, and the rasayanas like Chitraga, Lesuna, Bhalladaga, Pippali, Shilajadu can be applied in hypothyroidism, Kapajam. So hypothyroidism, Kapham, Manda Gunam, hyperthyroidism, Pittam, Tishna Gunam, Vamana in hyperthyroidism, Kapashamanam, Viredana in hyperthyroidism, Pitta Shamanam. And when you think about the different Ushnavirya, Siddhavirya drugs, the typical concept of Yoga Vaki Paramvayu, Samyoga Dupayarthagrit is applicable by modern investigation. If you measure TSH, T3, T4, you are really applying the role of Vata, Pittam Pangu, Kafam Pangu, Pangavo Maladhadavaha, Vayuna Yatra Niyandi, Tatra Gachandi Megava. So I will tell you, when you are getting a hypothyroidism by measuring T3, T4, you are prescribing Hamsabatyadi Kashayam, Gugulidikta Kashayam, Punarnavadi Kashayam, Asanadi Kashayam. When you are getting hyperthyroidism with the T3, T4 high, Pitta Dushti, Rakta Dushti and hyperactivity, Adipravarti, you are going to measure Ashwagandha, Amalagi, Guduji and all types of Shadavari spectrum. So this is the way how cellular level pathology with Tridosha and extended modern diagnosis will be working for a common factor. So every knowledge from the modern pathology can be applied, every knowledge from the modern laboratory investigations can be applied for a better practice in Ayurveda. Next. See, Dhatogni in the body affecting all the Srodasis, thyroid hormone, already told you, basic metabolic rate, BMR, and you read the functions of Dhatogni, both will be parallel. Weight gain in hypothyroidism, weight loss in hyperthyroidism. Why? Weight gain, Kapanu Bandham, Guru Gunam, Snigdha Gunam, weight loss, hyperthyroidism, Pittam, Tishnam, Ushnam only. That is why so many features of hyperthyroidism, hypothyroidism. In hyposangam, in hyper adipravarti, we learn all the Sroto Dushti. In adipravarti, Sangova, Stiranang, Grandhyo Viva, Vimargado, Vagamanam, Srodasam, Dushti Lakshanam. In hypothyroidism, Sangam. Sangha doesn't mean that there is a block in a vessel. Every physiological inhibition is Sangam. If I am talking and you are sleeping, Sangam. There is no Srodas connected with us. If I am talking and you are very much alert, Tikshnam. If I am talking and you are going out of the hall, it is Vimarga Gamanam. So what I am telling, Sangha need not be in a blood vessel. Sangha can be anywhere. When the Agni Sangha, the conversion will be minimum. Agni, Paga, Ushnaguna, Mandaguna, all connected. My humble left ventricular request to the all juniors, please learn the fundamentals of Ayurveda or homeopathy, whatever you are learning. Then go to the physiology by modern medicine. Then go to the pathology. And finally, the technologically advanced investigation. The cycle will be complete. Again, salute to Sustrada, Egam Shastra Madiyano, Navidyan Shastra Nistayam, Tasmad Begustruda Shastram Vijaniyat, Chigilsaga. Next. Then thyroid, you can see all the hypothyroidism, hyperthyroidism, you can see the bulging eyes, ectothalamus, sweating, kapha, pitta, in between vada. A very typical example. Next. I think there is Sangam. My dear. Next. The laptop is having Sangam. Okay. So next. Next. Already we told. So coming to the diabetes mellitus, you are getting the diabetes as the most notorious epidemic nowadays. The fasting blood sugar, the hyperglycemia, HbA1c above 6.5. All the measurements are really measuring the kledam in the recta. If you are an Ayurvedic doctor, you will always identify that kledam is the pathological component in Ayurveda. So raised glucose is kledam. In your first year, you studied Mutrasya Kleda Vahanam. Mutra will carry the kleda. What is kleda? Any Jeliya Rupa Malabhava can be called as kleda. Anything which is soluble with water, which is not needed for the body, is kledam. So I believe glucose is kledam. I believe creatine is kledam. All the unnecessary things are there with the Jeliya Rupa Malabhava kleda. So when you measure HbA1c, when you measure the fasting blood sugar, you are measuring the kledam only. I will tell one more point. There are 4 important pathological components. Please pay attention. It will take only 20 seconds. There are 4 major pathological components in the contemporary treatment circle. The first one is Amam. The second one is Shobham. The third one is Kledam. The fourth one is Abhishyandam. I think you are understanding. Ama in the costa is equal to Kleda in the recta, is equal to Abhishyanda in the netra, is equal to Shobha in the sandhi. You are getting all the eye disease, diabetic retinopathy. Again, Susruta told, Prayena sarve nainamayastu bhavandi Abhishyanda nimitta mula. Abhishyanda is the srodo dushti sanga, congestion in the eye, the glaucoma, increased intraocular pressure. You are measuring in glaucoma, and that is nothing other than Abhishyandam. Abhishyanda not treated properly will be damaging the eye. Kledam in the rectum is hyperglycemia. Hyperglycemia, if not managed, will be going to the netra from costa, then you are getting retinopathy. So Kleda in the recta in diabetes will be leading to Abhishyanda in the netra. That is the connecting link between costa and netra roga. That is why beautifully they told in Shalakya, Sarva roga nidanokte rakide kubidamala ajashusher visheshena praya pittanusarina sirabhi urdam prasrdaha netra vayava mastrida. That is why in glaucoma also you are administering Virejana with Trivat Lekham, Kalyana Gulam, Tripalachurnam, Pittakaram, Rektakaram, Pramekakaram, Netrium. Are you getting me? That is why AAA is a wonderful drug in Prameha, a wonderful drug in Netra, and a wonderful drug for Costa. So my point is very simple. Netra, Abhishyandam, Rekta, Kledam, Amashaya, Costa, Amam, and Sandhi, Shobham. All the 4 components can be measured by modern laboratory investigations. Next. Then lab investigations versus Kleda, Prameha, Kleda, already told you, when you are getting more than 1.4 milligram per deciliter of the creatine, it will be damaging the kidney. All the end stage renal diseases are due to the progressive accumulation of the serum creatine. It is a Kleda bhavam. Prescribe Shilajadu, prescribe Gochuda Gugulu, prescribe Viradaradi Kashayam, prescribe Gochuda Chidabagam, depending upon the stage. I will tell you, Ksharam in Kapam, Kshiram in Pittam, Thailam in Vadam. Why? Ajare beautifully told all the degenerative conditions with Ruksha Gunam Vatam. Juniors, please pay attention. all the degenerative conditions with Ruksha Gunam Vadam, all the inflammatory autoimmune mediated conditions with Ushna Tishna Gunam is Pagam Pitta Pradhanam, and all the accumulative, congestive, obstructive pathology with Guru Manda Snigdha Slashna Sandra Murdu Sthira Guna Kapam is Kapajam. So these three levels can be beautifully identified by modern investigation. That is the point. Rogastu Dosha Vaishamyam. If you can predict the status of a dosha and predict the gravity of the dosha by a modern investigation, really you are going to apply the science with more confidence. Next. See the simple example, proliferative diabetic retinopathy. Normally we will tell the Janagana Mana of Netra Roga in Ayurveda is Takshus Tejo Mayam. Tasya Visheshal, complete. Very good, very good, very good. I am very much thankful that there is a real heart of Ayurveda beating in this particular Ayush Havva. There is real Chedana, there is real ojas of Ayurveda. Chakshus Tejo Mayam, eye is vascular. Tasya Visheshal Sleshmana Bhayam. Wherever there is fire, the fear will be from water. In Ramayana, we very well know when there is Agneyastram, Varunastra will come. I think it is very simple. Agneyastra, Varunastra. So the vascularity, the blood supply to the retina will be damaged by the kledam, kapham, jalarubam. What is kapham? Kena jalena bhavati iti kapham. The normal kapha will bless, the abnormal kapha will destroy. So the kapha will create a block in the eye. That is why you are getting all the further episodes of diabetic retinopathy. Please see the picture. This is a typical ophthalmoscopic fundoscopic picture which will be telling the normal retina, Chakshus Tejomayam, but in the second picture you can see peripheral hemorrhage and neovascularization. My dear children, what is new? What is vascularization? Measure the growth of new blood vessel. So new blood vessels are produced due to the retinal hypoxia, that is Adipravarti. Are you getting me? Somebody will teach that Adipravarti is excessive diarrhea. My dear, you tell me a warning 5 minutes before, okay? Your eyes are very much Chakshus Tejomayam. Heart is filled with Rajoguna, with the hyperbeat. Okay, so what I am telling, whenever you are getting more and more kapha, the blood supply will become low, then the retina will grow new blood vessels to compensate the ischemia. That is what is called neovascularization. In our UG, we studied that excessive diarrhea is Adipravarti, excessive vomiting is Adipravarti. No. The growth of new blood vessels is also called Adipravarti because vascular endothelial growth factor, VEGF, vascular endothelial growth factor will stimulate the proliferation of the new blood vessels when there is retinal ischemia due to diabetes. That is Adipravarti. So a very good examined fundoscopy will tell what is Adipravarti. Sira Grandhi, you are getting the so many types of aneurysms. Perianeurysms, fusiform aneurysm. Aneurysms in the retina is Sira Grandhi and obstruction is called Sangha, and retinal exudates are coming. Macular edema, that is Vimarga Gamanam, and you are getting Adipravarti of the Srodhas, neovascularization. So even a fundoscopic picture of retina, also you can interpret Srodhodushti. That is the knowledge of modern systems in treating Ayurveda. Next. Then stroke, you know, there is ischemic stroke and hemorrhagic stroke. You can definitely go with the CT scan, and CT scan will tell you what is ischemia. Ischemia may be leading to infarction, a avarana-like pathology, a shifting pathology in the brain. On the other side, a hemorrhage, maybe intracranial, maybe intracerebral, which will be leading to further problem. Grihitvartam tanorvayu siras nayur vishoshija pakshamanyadaram handi sandibandhan vimokshayan krishnartha kayastasya Syat Akarmanyo Vijedana Pakshagadam. Pakshagada Avaranam or Dadushayam. Treatment vary. The diagnosis can be empowered by modern imageology. Next. You can see the first thing, right, left, you can very beautifully see the normal area and acute infarct area. That acute infarct area will be having a pressure effect, mass effect, deviation effect, that is equivalent to Avaranam. Chitragarasayanam, Lusudarasayanam, Tishna, Nasyam, and all other treatments are indicated in such a condition. Phalladaga. Semicarpus anacardium is becoming a potent drug wherever there is an obstructive, suppressive brain pathology, because Phalladakam is medium, Phalladakam is avaranakaram. Kapajostina rogostina vibandosti yaschanaha yamna Phalladakam hanyad shikram agnibalapradam. So whenever there is an ischemia, protection should be there, because there may be a pressure effect, there will be a shifting effect, and that is coming under avarana pakshagadam. Next. And when you are getting a hemorrhage, definitely hemorrhage will be there. There also it will be clotted, and you have to treat according to the Rekta Pitta Chikilsa and Dadushe Chikilsa. So you will be prescribing immediately after the initial ventilator, initial ICU care. You are going to give the medicines which will be having Rekta Pitta Karam, Shadavariyadi Kashayam, Shadavari Chinnaruhadi Kashayam, Trayandyadi Kashayam, followed by Varanadi, and all Pitta Rekta Kara Nasya Karma, Vijayana Nasya, etc. are given. Chandana Dailam Dhara is given, Pitta Rektakara Chikilsa in hemorrhagic, and Kapavadakara Chikilsa in ischemic. That is the basic pathological differentiation. Next. So finally, lab investigation versus Kriyagalam. If there are first year student, Kriyagalam, you very well know Sanjayam, Pragobam, Prasaram, Sthana Samsrayam, Bhakti, Bhedam. Increased serum uric acid, Sanjayam, further increase Pragobam, further increase moving to other area, Prasaram, and localizing in the big toe, Sthana Samsrayam, going to the kidney, Bhakti, and damaging multiple system with serum uric acid, Bhedam. So serum uric acid chayam to the Bhedavastha with multiple uric acid stone in the kidney and uric acid arthritis, that is Vimarga Gamanam. In Chaya Eva with treatment, if it is done, you do Viredana with Kalyana Gulam, you prescribe Kogilaksha Kashayam, you prescribe Manjishtadi Kashayam, you prescribe Shadavariyadi Kashayam, the Chaya of the uric acid can be prevented. So I am telling uric acid can be considered as a Sama Pitta. Uric acid is nothing other than a Sama Pitta, because Vidakenyam Viruddham Jatattachasur Pradushanam Pajadam Vidhihinam Jasopna Jagara Maidunam Prayena Sugumarana Majangramana Shilinam is very much applicable with the production of the uric acid from purine metabolism, preferably those who take red meat, beverages and other Vidahi Viruddha Ahara. Vidahi Ahara, Viruddha Ahara, purine metabolism, uric acid, Pitta Rekta Dushti, This is the beautiful axis of uric acid related pathology which can be measured by modern investigations. Next. You can see that is why Padayor Moolamastaya Kadajit Hastayorabi. Very beautiful it is mentioned, Padayor Moolamastayam. And from the Pada it will go to the kidney, you are going to get uric acid stone. So an intelligent Ayurvedic doctor will treat the gout arthritis, by which he can prevent the uric acid stone. So while doing the treatment, he is preventing some other disease. Are you getting me? While doing the treatment for gout, he is preventing some other disease. That is the Shuddha Chikilsa, classical Chikilsa. Next. I will take only 1 or 2 minutes. So next, Ama Nirama. So many things are there. Actually, this topic needs more and more time. Next. ESR and CRP are indicating the acute inflammatory stage. Next. C-reactive protein will be always high, so do Pitta-kara Chikilsa, Dhatu Paka Chikilsa, Videjana, Tiktaka Grida, and Videjana, Dadima Grida, etc. are there. Never ever do Videjana or Kridabana in Namavastha. Next. Then Uttana Gambira, superficial stage is Uttanam and deep stage is Gambiram. Again, Dhatu Paka is important. Next. Vishamajwara, Sannibadwara, multiple. SLA, I already told you, ANA, anti-nuclear antibody will tell multi-system involvement of autoimmune disease. Next. Lab investigation specific disease, renal function test, you very well know the creatine content is important, urea level, BUN, all will indicate the Kleda Vahana in recta. Next. Lab investigation, liver function test, LFT, AST, ALT, everything. And they will be telling how much liver is secretory. The secretory component of the liver is measured. That is why fatty liver, hepatitis, liver cirrhosis, Lodaram, Halimagam, Alasam, the terminal stage of the liver cirrhosis are beautifully mentioned. Kamalat to Pandu, hemolytic anemia, RBC count is important, bilirubin content, Paga, Pitta Darsana, Pida Vinmutra Netra. So every pathology mentioned in Ayurveda can be measured by modern medical knowledge. Next. Then Daduvaga Srodorada. See the picture. This is very simple, very simple. Rasavahanam Srodasam Hridayam Moolam. Dasadamanya Hridayam Moolam. And you very well know the blocks are cast by Abhishendi. What do you mean by Abhishendi? Paichilyat Gaurava Dravyam Rudhva Rasavaha Sira. Dattayat Gauravam Tayad Abhishendi. When you do the ECG, when you do the angiogram, you are measuring the sangam in a particular Rasavaha Srodas. And if there is a sangam more than 50% Kavai Gunya, Shulam tu Vigno Anila, Angina pectoris. Shulam tu Vigno Anila. Obstructed Vada is pain. Obstructed Vada is pain. This obstruction is measured by angiogram, that is by Vyana Vada Pradilomada. Whenever we are getting ECG, we will write PR interval. We are write ST segment elevation. I will write VVP, Vyana Vada Pradilomada. Give a Resonadika Shayam, Lesinachida Bagam, Ardunachida Bagam, Virejanam, Hridya drugs. That is why Viguna Vyana Vada can be brought back to Anilomana. I am concluding all the modern investigations inside a Srodas like angiogram, colonoscopy, bronchoscopy are telling Vigunavada. Obstructed Vada is Vigunavadam, pathology. Normal conditioned programmed Vada is Anilomanam, health. Arogyo Anilomanameva. All the laboratory investigations are measuring the Anilomada Vayu only. Next. So many are there. This already we discussed. Next, OJS and immunology, everybody knows spine. Next. See, one more slide, just 1 minute. See the MRI of a spine bulge. You can see between L5 and S1, you are getting the black disc. You are getting the black color disc, and which is thin. See, normally the fluid content from the disc is taken out, the disc is dehydrated, and dehydrated disc will appear black. L5, S1. And when you talk about Vada Vriddhi, Vruddhastu Kurude Anilaha, Karsya, Karshnya. We studied in Ashtangridayam Sutrasanam 11th chapter, Doshadadu Maladi Vijnaniyam, Vruddhavada will lead to Karshyam, thinning of the disc. You can see between L5 and S1, and Karshyam, black colored because no more fluid. So what I am telling, next time when you see this MRA, you need not write between L5 and S1, there is dehydration. You can write K plus, K for Karsya, K for Karshya. That is what I am telling. Even MRA can measure Vada. Are you getting me? An MRA can measure Vada because MRI is Amurtam, Vada is Amurtam. Only Amurta can identify another Amurta. So even in the updated MRI also, you are able to, you are free to, you are proud to apply the Ayurvedic fundamentals. Next. Again, you can see L5S1, very thin disc, black disc, Karshyam, evident. And the above disc are grey because it contains water. A water containing disc will appear grey, a dehydrated disc will appear black. Simple physics, simple Ayurveda, both are equally comparable. Next. Already so nephrocalcinosis, adipravarti, calcium in kidney. Next. So many are there. Next. We will go to the last slide. Next. Okay, next, wait. So what I am telling, because no time, there are so many other speakers. Only 1 minute, final 60 seconds, you can count Ajay 60. When you tell, I will be telling thank you. From now onwards, you need skill. If there is no yes in the skill, what is remaining? Kill. You are killing your skill and you are killing your patient. If there is S and K removed, ill. You are creating illness in your knowledge and you are creating illness in others. If you remove SKI, you are creating L lifelong. So update your skill, otherwise you are killing or creating illness. That is my humble left ventricular message. Let this Ayush Haвва conference will empower your skill. Wait, 1 more minute. Only 30 seconds remaining. Next, so the third eye, never keep the Taliolas kept in your textbook. Open it daily, read it. Hasta Samyogam is not needed. Hasta Samyogam not needed. Hasta Pustaka Samyogam. Take the book. Pustaka Mastaka Samyogam. Take to the brain. Mastaka Manava Samyogam. Take the knowledge from the public and then take them to the public. That is the only way to promote the Ayush systems. Wait. So next slide. My dear, next. So Ayurveda diagnosis versus artificial intelligence is coming, and that also you have to pay attention. Without your dhi, your tridi, your smriti, no artificial intelligence, so empower it. That is my humble request. Next. Give hopes, be positive. Doctor, I am afraid you are dying and you don't have much time. Patient, oh no, that is terrible. How long have I got? And doctor, 10. Patient 10. 10 means what? 10 months, 10 weeks, what? No, 10, 9, 8, 7, 6, 5, 4, 3, 1, 0. So, very less time for you, very limited time for you to update yourself. All the activities in and around Ayush and advanced technology should be taken into your left ventricle. Never say no to any knowledge. Absorb every knowledge. Empower day by day. That is my humble request. Next slide. So, dedicated you. Next slide. Next slide. Next slide, next slide. So I am very much thankful to the organizers, especially my dear student Ajay and the entire team, because learning Ayurveda is a beautiful thing. Applying modern medicine is a beautiful thing, because you are saving the life of a brother or sister. For the Ayurvedic doctor, every patients are brothers and sisters, because Atmavas Sadadam Pashyedabi, Kida Pipiligam, all the Ayush sector, Ayurveda, Homeo, Unani, Siddha, Yoga, let us work together by which a better day will be created. Learn Ayush, love Ayush and live Ayush. Thank you very much.
Thank you, sir. Thanks a lot for such an engaging and thought-provoking session on modern diagnostic tools. I now request the chair and the co-chairperson to give their valuable inputs.
Good morning to all of you. Dr. Gopakumar sir, he clearly drawn a silver line between the Ayurveda concept as well as the treatment concept. It was beautifully narrated by sir. Not only the investigation he kept the last line, because what I am saying is, he correlated with the disease symptoms, investigations, and after the investigations, to have the prognosis of conditions, the disease conditions, and to bring him to the healthy state, he defined so beautifully the medicines which are applicable through the Ayurveda. He has stressed maximum on the part of the concept, the science of Ayurveda. On this occasion, he made a attempt to make all the Ayush system, they have to concentrate on their, whatever they study, they stress on their text, they stress on the thorough study of their science, so that they will make them very successful in the practice. He correlated with the external factors, which as a homeopath also we expect that external factors, internal factors, and the investigation part. And beautifully correlated based on it may be the blood, it may be the nerves, it may be the plasma level, or it may be the heart tissues, or whatever part of the bodies, with related to the very clear medicines are applicable to the treatment part. So I hope all of you enjoyed the first session. I extend my thanks to all the organizers of Ayush Haвва for giving an opportunity to be as a chairperson for this occasion. Thank you one and all. Thank you, sir.
Thank you, sir, for your valuable inputs. I now request the co-chairperson, Dr. Vidya Prabha ma'am, to give her valuable inputs.
A very warm good morning to all of you. Definitely this was a very wonderful session by Dr. Gopakumar sir, an enchanting one too, because we were all so engrossed into his session. And I would say in this era of artificial intelligence and almost all the public having these fancy apps and the smartwatches which they themselves will be giving the diagnosis. This was a very key session, you can say, and how sir had started with saying that it is a brain game. and that the students have to start learning with the Paramanu, that is the individual cell, and how they have to go ahead with the physiology, the pathology. And it is not that the modern diagnostics tools will help you in finding a diagnosis which is relevant to the allopathic science, but how you have to decode that into understanding the samprapti and into understanding the dosha levels, the dhatu imbalances which is happening, and how you have to apply your knowledge in the drugs to identify the right treatment for those. That was really, really wonderful, sir. For me too, I think this is the second session. Unfortunately, I couldn't attend much of it, but it was very much helpful. And you know what sir has told throughout, from what he has begun, that it's a brain game, and with the power of the brain, the human brain, I think even if the artificial intelligence and the computers and the new technologies can decode everything else, I think Ayurveda, a physician's brain, is very must to understand and give the right treatment. So thank you very much, sir, for this wonderful session, and thank you for the Ayush Haववा committee for having given me a chance to be a co-chair in this session. Thank you so much.
Thanks a lot, ma'am, for sharing your opinion. I now request Dr. Narayan Asra, Vice President Ayush Haववा, to honor our today's speaker, Dr. Gopakumar, sir. I request Dr. Ajit Kamath, Joint Secretary Ayush Haववा, to accompany him. I now request Dr. Ajit Kamath to hand over a token of gratitude to our chairperson, Dr. Vijayendra Itagi, sir, and also to our co-chairperson, Dr. Vidya Prabha, ma'am. Scientist, Mysuru, to speak on the topic Role of Millets in Healthcare, India's New Gold Mine. The session will be chaired by Dr. Sandeep Bekal, Principal, Sharada Ayurveda Medical College and Hospital, Mangalore, and co-chairperson will be Dr. Roshan Pinto, Principal, Alwas Homeopathic Medical College, Hospital, Modbidri. I now request Dr. Ajay Bhattu, Joint Secretary Ayush Haववा, to escort the speaker, chairperson and the co-chairperson onto the dais. Thank you, sir. I request the speaker, chairperson and the co-chairperson to kindly take their seats. I take this opportunity to introduce Dr. Khadar Valli. Dr. Khadar Valli is popularly known as the Millet Man of India. He has worked relentlessly for the past 25 years and has been successful in bringing back millet food to the consciousness of human race. Along with millets, he is working to develop sustainable living models for the planet. Born on 15 Jan 1958, Dr. Khadar received his Bachelor of Science Education and Master of Science Education degrees in 1979 and 1981 respectively, and got his PhD in steroid biochemistry from Indian Institute of Science, Bengaluru. He then worked as postgraduate fellow in Oregon Graduate Center, Oregon, USA till 1991. He then joined CFTRI Mysuru as senior scientist in biochemistry and nutrition department. In 1993, he went back to America again to join DuPont Company, Wilmington, and worked as a scientist in various departments till 1997. Realizing that there was a need to redefine and change our food habits, he resigned his job and returned to India and worked as an independent scientist to establish the role of millets in preventing and reversing modern-day disease. Dr. Khadar established Hasuru Honey Clinic and trained doctors to use food systems to heal people along with homeopathic medicine. Since 25 years, he has actively been traveling to villages and cities across Karnataka, Andhra Pradesh and Telangana, and from the past 5 years all across India to spread awareness about millets as a staple food grain and their importance in preventing and healing diseases and as the most sustainable food for the future. He has been invited as a speaker on millets in USA, UAE and Nigeria. Dr. Khadar has also trained thousands of farmers on rain-fed agriculture called Jungle Krishi. Dryland farmers across India who were marginalized are now becoming economically sound as a broad demand for the villagers' produce as superfood across Indian cities. Dr. Khadar is a recipient of several awards like Padma Shri Award in the year 2023 by Government of India, BRICS CCI Agriculture Visionary Award 2024, Mahavir Ahimsa Parishad Prashasti by Jain Association Mysore, Guru Basava Puraskar by Basava Seva Pratishtana Bidar, Krishi Ratna by Rutu Neshtam Foundation Andhra Pradesh, presented by the Honorable Vice President, Madhe Gowda Pratishtana Award by Bharati Educational Trust Mandya and many more. It's indeed our privilege to have him here with us today. I now invite Sir for the talk. Sir, over to you.
I am little bit uncomfortable with Ayush department as a whole imbibing the culture of allopathy in a subtle manner. Because the allopathic system, modern medicinal system, is actually not based on true science. It's more of business enterprise. So, I want to draw a clear line. There have been completely unscientific narratives built by the Western thought process. In doing so, the so-called patent system and entertaining the business into the science of human health has happened, which is absolutely immoral, which is absolutely unscientific. So the concept of sponsorship into the research came to existence, and the first and foremost was the Sugar Research Foundation, completely ignoring the holistic way of living. And these organizations funded Harvard University not to mention the diseased condition that sugar consumption can make a human body. And in fact, all the modern day diseases are nothing but glucose imbalance in our body. Everything, almost everything. And this heightened glucose release into our bloodstream, disturbing the homeostasis, that is glucose concentration in our blood system, gone completely gone out of whack. 5 grams of glucose should be present in your whole 5 to 6 liters of blood. This is called homeostasis. And the modern food systems have no mention about this. So anything that you eat should and must maintain the homeostasis of the blood. So, the whole modern food systems have been propped up to create a disease. And you are still trying to say what they have done is right. Absolute nonsense according to me. Absolute nonsense. And I did try to blend into the regular organizations, but I could not. That's why I declared myself as independent scientist. Because the basic fundamental aspect of food itself is thrown out of window, and the whole world is made to eat rice and wheat. Absolute nonsense. Because you cannot produce rice and wheat in its natural systems. And without questioning this, whole departments of Ayush are talking. That's what I said, I'm uncomfortable. So we need to define food. High time we defined food. Who defined food? No one has defined food till now. Why are we all eating rice and wheat, which we cannot grow? And there are foods that were grown throughout the time immemorial, all over the planet. C4 grasses called millets. They grow without water. They grow from 10 degrees to 45 degrees. And we have eliminated them from this planet at the behest of this food corporate culture. And without questioning the food corporates, how you are all talking about health. So the fundamental line has to be drawn. So that's where I had to get out of all these systems and then ask the question, are we eating right? If our food is right, there is no need of medicine. And if your food is wrong, no medicines work. Come on, you need to clap. With all their celebrated technologies, have they cured single disease? Is the question to ask. You have BP, you have to take tablet. You have diabetes, you have to take tablet. You have thyroid, you have to take tablet. You have rheumatism, you have to take tablet. You have arthritis, you have to take tablet. You have this, take tablet. How long? Come on, answer me. How long do you need to take the tablet? Lifelong. Are they giving any treatment? They are selling the tablets. Nothing else. And don't you think this is business? If the science is right, at least one disease has to be cured. Why are we not asking these questions? When the food is wrong, no medicine works. Who told this? People think Dr. Khadar is saying this. No. Yukta ahara viharasya, yukta chestasya karmasu, yukta swapna avabodhasya, yogo bhavati dukkhaha. If your food is right, if your actions are right, if your sleep is right, if your awakened state is right, with yoga, you can eliminate all suffering. Who said this? Come on, someone please. This is Shri Krishna Uvacha. Bhagavad Gita, 6th chapter, 17th sloka. So have we defined food? Food is that does not disturb your homeostasis of the blood. And all the food that is eaten, including Ayurveda, hospitals, is nothing but rice and wheat. So what are we talking? Rice and wheat within 15 to 20 minutes floods your blood with glucose, and the heightened glucose has to be managed by all the endocrine system, and here you have cholesterol, triglycerides, rheumatic factors, uric acid, everything. So what are we talking? All this nonsense. So if you change your food, all these diseases will just disappear like that. Just like that. On top of it, we go on labeling, this is chronic disease, this is non-communicable disease, this will not be cured, this is called chronic disease. And then we have entered into a domain of incorporating the diseases into the kids. Now type 1 diabetes, mental retardedness, ADHD. That means we are entering a different domain of diseased, sick world. Type 1 diabetes, never curable. It is genetic disorder. Wow. So why are we trying to catch up to these guys? These guys still recently believed that sun is rotating around earth and earth is flat. And Charaka has told what Sampurna Arogya is. So you are all talking about disease. Our ancestors talked about how to be healthy. Greens and vegetables, tubers and roots and grains is the Sampurna Ahara for Sampurna Arogya. This is not told by me. Charaka Mahanubhava has said this. And how wonderfully he has classified greens and vegetables, nascent fiber, roots and tubers, immature fiber, polysaccharide fiber, grains that were available plenty all over the planet were millets. Embedded, enriched with complete matured fiber of aromatic nature. And here you see the parameter to divide the food is not based on the nutrition alone. It is based on detoxifying the body each and every minute of your life. Please follow these things because no one has till today talked about these issues in the whole world. And we have found, we have reversed all these so-called modern day diseases, name by name. Not 1, 2, 3, 4, 5, 6, not hundreds, thousands. The so-called BP, so-called diabetes, so-called thyroid, so-called type 1 diabetes 2. So I don't want to take much of your time giving you testimonials which you actually can search in the social network. Thousands of them are available, but I just want to show you one, just one testimonial, please. Multi-organ failure, kidney kaput, liver cirrhosis, brain not functioning, get them onto millet food. Lo and behold, in a matter of 6 months, everything restored back to health. Like that, I can go on rambling one after the other testimonials. Blood cancer, gone like that in 6 months. So, all these diseases are actually concocted upon in human race in the last 25-30 years just because we have not questioned this corporate culture. So if your food is right, there is no need for anyone to have any disease, because the principles have been declared by our ancestors. Very simple. Your glucose balance, madhu, balance has to be maintained. If your blood becomes loaded with sugar, it is so simple. Even biochemistry, simple principle. When you eat anything, you are supposed to be loading your blood with glucose. But that should be done in a regulated fashion, so that 5 grams per your 5 liters of blood glucose concentration never increases. That means the regulated materials that can release the blood sugar into your blood in a systemic controlled fashion. Who can do that? That should be the definition of your food. And who did the definition? Our great Charaka has done it, kept it ready for you. But we don't want to listen to that. Greens and vegetables, nascent fiber. That means anything that goes into your mouth should have some fiber content, and absolute zero fiber content in all the modern day foods. And how, as two Ayurveda doctors, allowing that to happen the other side, and then started talking about diseases. Ayurveda means life from birth to death. That is Ayu. It's not just about your Ayush. It is about the Ayush of all the living things around you. The plants, the animals, the systems, everything you should know about around you. Then Paka Shastra, the way you deal and consume, rather utilize the things around you, the greens, the tubers and roots, the grains that are available around you. So why are you eating wheat which you cannot grow in Kerala? Wheat is a C3 grass that grows only in cold regions, cold air. Why the hell the whole world is eating wheat? We didn't question. Why are you drinking milk? IVF, each cow giving 30-40 liters of milk. And what is milk after all? Milk is the first food a mammal gives its baby. And how does it deliver? When the baby puts its lips on the sthana, the mother's mammal glands recognize what is required for the baby. And if the baby is sick, the milk doesn't produce too much nutritious. It gives medicine, anti-inflammatory. That means milk is dynamic for each and every day the baby is growing. And when it stops, the milk stops in the breast, the enzyme that digests milk stops in your gut. So why are you still continuing to drink milk? The whole world now is producing trillions of liters of milk. Milk is not something dead. And drinking milk is what is bringing hormone imbalance. All gynecology departments have appeared. There is not a single gynecology department needed if the human race stops drinking milk from tomorrow onwards. In next 2 years, I will close down all gynecology departments. And that is the reason why men have sperm count coming down. Now 20-30 million is okay. The modern pathological labs are writing it's okay. It should be 120 million. 100 is gone, you have only 20 million left. Agenosporia, azoosporia, astinospermia, all kinds of diseased conditions you are writing. Have you cured a single case? No, we have IVF centers mushrooming all around the world, even in villages. What the hell does it mean? You cannot produce your own kid. Wow. Claps, man. the birth rate of all the countries, including India, has come down below 2.1. That means in the next 40-50 years, your nation will disappear from the planet Earth. Many countries on this planet are disappearing. There are no Koreans, there are no Japanese, there are no Germans, because their birth rates have come down to 1.2, 1.3. And we are on the way, 1.9 now. So why should we not talk about the right food that increases health? So what is the right food? We should be involved in making humans healthy, not talk about diseases and go on ramping around the sales of the tablets, sales of MRI scan, PET scan, CAT scan and whatnot. You are not getting health in the hospitals. You are getting what? Extension, management. So where did you lose your health? In the kitchen. Where are you searching for it? In the hospitals. Claps. You are not ready to clap, because we are also following the path of business. Let's make common man healthy. Can we cure gangrenous condition? Yes, we can. Can we cure thyroid issues? Yes, we can, if the food is right. So, what you should not eat, what you should eat should be the prerogative and the duty of the physician to refer to the patient. Are we doing it? Hey, eat whatever you want, you take this tablet. You can leave your wife, but not this tablet. Where are we going? So here I have come to deliver these questions, not a lecture. And we have found the answer. I have taken 20 minutes. So I will finish in another 20 minutes. I would like to now tell you about millets. People, the so-called experts, are saying forgotten grains. Absolutely not true. These are not forgotten grains. These are the grains archaeological diggings in the dental reminiscence 178,000 years ago. When Varahaswami brought Mother Earth, he was asked what should be given to reduce his Udvega. What was that? It was Priyangu Payasa, that is foxtail millet. When Balaji got hurt, Vakula Mahadevi treated him with little millet payasam as Naivedyam and he got well. The gangrenous condition got well. When Rama, Lakshmana, Sita went to Vanavas, Lakshmana tied foxtail millet in his seragu. Sita tied little millet in his seragu. Rama tied Ram Tilka seeds in his seragu. So these kinds of Ullekhana and referrals have been all along, not only Indian literature, all over the world. And rice and wheat did exist but very rare. And if you now go back to 200 years, 300 years of Indian history, food history, and there is no food history subject on this planet. No one wants to talk about the food that existed. Millets existed for time immemorial. There have been 240 varieties of millets on this planet. Millets are C4 grasses whose photosynthesis is absolutely different. Without water, just absorbing the water from the moisture content of the environment, they can make the grains. That means food can be made everywhere and anywhere. In Himalayas to Rajasthan desert, we can grow millets. 10 degrees to 45 degrees. That's how God created food, not only for human beings, for all living things. C4 grasses, though very special, exist on 68% of the land on this planet. And C3 grass, rice and wheat, do not exist, not even 0.3% of the planet. And now, these food corporates, the fertilizer companies came and made this 0.3% growing grasses to be the universal food, and God-given universal food has been relegated to primitive food, bird feed, and animal food. And then all over the world, everyone has been twisted, called hand twisted, not to grow these things and grow only rice and wheat, because these seeds are patented and the food corporates are making money left and right, because the whole world consumes rice and wheat. 800 million tons of rice is grown. 800 million tons of wheat is grown. 1600 million tons of soybean is grown. 1600 million tons of genetically modified corn is grown. And these are mixed and made animal feed. Now, one side chicken, one side pigs, one side cows are grown. And now, they are spinning what is called pink revolution. Green revolution, rice and wheat. White revolution, milk. Now pink revolution, protein, in the name of protein, meat is promoted. So everyone has to eat meat because you need protein. You need protein. This is the Goshavakya. You do not need protein as this modern day doctors and scientists are talking about. You only need 5% of protein in your food. No, the consuming culture of Western thought process is defining 1 gram per 1 kilogram of body weight. Can you believe this nonsense? But you do believe. It's so much so that Ayurveda doctors are now translating that into, plant protein. You take this much sprouts. You eat sprouts or meat. If the protein content increases, pyrimidine metabolism screws up and your uric acid goes on increasing, disturbing your kidney, and now we have dialysis units coming into picture. Can you see how beautifully they are creating more and more business? So now if all the doctors in the world tell the patients, do not eat protein so much, because not even a single peptidase exists in your mouth. Not a single peptidase. Till it reaches the celiac region, there is no digestion of proteins. Unless HCl comes into picture, you cannot digest protein. It's only 5% of your food should be protein. The increased protein content will obviously instigate the production of these protein metabolism diseases, uric acid, creatinine, albumin, urea, and autoimmune diseases. ಕನ್ನಡ ಬರುತ್ತಲ್ಲ ಎಲ್ಲರಿಗೂ? I just want to quote one Kannada poem by Basavanna. ನದಿ ಉದಕವ ನದಿಗರ್ಪಿತ ಮಾಡಿ ಮರಹೂವನ್ನ ಮರಕೇರಿಸಿ ಕರುನಗಟ್ಟಿ ತಾಯಿನ ಮರುಗಿಸಿ ಮೊಲವಾಲನ್ನುನಬೇಡವೋ. ಕರುವನ್ನು ಕಟ್ಟಿ ತಾಯಿನ ಮರುಗಿಸಿ ಮೊಲವಾಲನ್ನುನಬೇಡವೋ ಕೂಡಲ ಸಂಗಮ ದೇವ. ಹಲವರ ಬಾಯಿ ಟೊಣದೇ ಹೋಯಿತು. Don't drink the milk. The milk is meant for the calf, not for you. Your milk is meant for your baby. And if you do so, halavara bayi tonade hoyitu, you will get the stomatitis, which is an autoimmune disease. So the higher protein intake will cause you autoimmune diseases. And this is what we are facing. And this is what I mean by Ayurveda people warming up to this so-called Western thought process. Absolute nonsense is going on there, and you want to find some way or the other to that. In nature, the legumes per acre give you 2 to 2.5 quintals. The same 1 acre land gives cereals, that is millets, 8 to 10 quintals. The ratio is 5:1, and that's what our ancestors have been following in our food systems. Whether it is idli or dosa or khichdi, this is the ratio that they used. But after listening to these guys who didn't know that earth is rotating around the sun, they are dictating what we need to eat, so much so now that we are ordering on Zomato, Swiggy, pizza, burger, Hyderabad pulao, Kashmiri pulao, Hyderabad biryani. The non-vegetarians have increased in the last 20 years all over the world because the consuming culture of this Western thought process, because they want to sell the corn, genetically modified sweet corn all over the world. Of course, if you are aware of the Trumponics, 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 he is trying to arm twist everyone to sell its genetically modified corn so that all others can make beef and sell him for free. So you understand, this consuming culture of Western thought process is driving our natural food systems and food materials out of our kitchens and making us, everyone, sick and driving us to the pharmaceuticals. And the only companies that are making money is pharmaceuticals. So according to me, this is a vicious plan, and you are not deciphering it. So the simple solution is just say no to these modern foods creating the modern diseases. Disease by disease we have taken, and then yes, from where you are, you can download all the PDFs in different languages: Kannada, Telugu, Hindi, Malayalam, Gujarati, all languages. And what food you eat for what condition, thyroid, dialysis, all this listed, and you can actually make them eat the food that we have prescribed. In a matter of 3 months, you can throw away their insulin. Can we do that? Are you ready to do it? So take 100 type 1 diabetes kids, feed them this food, and then give them oils. You can throw away the insulin in a matter of 3 months. take 1,000 obese persons, feed them the food, all 1,000 will lose their weight without a single health issue. Take 10,000 diabetic patients, feed them the protocol. In 3 months, they will throw away their tablets. Am I shocking you? Actually, it is as simple as that. It is the rice, it is the wheat, it is the egg, it is the milk, it is the sugar that is causing the diseases. And without questioning this, you are all talking to cure diseases. How can you? Yuktahara viharasya. What is the right food? Right food is something that does not disturb glucose balance of your blood. Food is something that does not disturb hormone balance of your body. And these two balances in the last two imbalances, glucose imbalance and hormonal imbalance, has systematically been killing the gut microbes in the last 40 years. Listen to this. This is the most important aspect. The gut microbiome is actually the microbes that do good for you rests in your celiac region. The epithelial cells that have the turnaround time of 3 to 4 days has to be replenished in its full health on a regular basis, for which without gut microbiome, without the symbiotic bacteria, which are actually more than trillion times than your living cells, that means in fact we are actually floating in the ocean of gut microbiome, and our existence actually depends on this gut microbiome that we think we are harboring. Though small in shape and size, they are the ones which control our physiology. Balance is restored. Unless your hormonal balance is restored, you cannot keep your gut microbiome in place, because the microbiome, which actually does the multi-speciality doctor's job in your tummy. Tummy is an unscientific term. The celiac region, we host trillions of gut microbiome, which actually cures your diseases, which makes the nutrients reach each and every nook and corner of your body parts. It actually prepares, synthesizes many of biochemicals that our bodies cannot make. So we have been killing this gut microbiome in the last 40 years. It should have been 2.5 kilograms in any human gut. We only have 1.3 kilograms right now in the modern day human body, including tribals have been experiencing this problem because they have also been given rice and wheat and milk, which are causing this unimaginable damage, and these doctors are not talking about it even once. How do you restore this wonderful gut microbiome which can actually cure you? That means the multi-speciality hospitals are appearing on the streets, but they cannot do any job for you. All the multi-speciality doctors put together will not be able to serve you. What you need is the lining of your celiac region being replenished with the microbes. Please show me that. Where did it? Please zoom that. Zoom it. And these microbes can be replenished in your gut only through millets, because millets are fibrous grains. It is the fiber which is prebiotic that can harbor, invite, synthesize, make it appear in your gut. And that's why we have taken millets which have got wonderful enriched fiber which is aromatic lignans that can invite diversified gut microbes, and that was the case all along throughout the history of human beings. Whoever ate rice and wheat had the problem of madhumeha, then the gut microbes killing, because once the sugar increases, pathogenic bacteria take over, symbiotic, well-to-do, wellness centers disappear. So, if you want wellness in your body, you need to make the wellness agents appear in your celiac region, and only fibrous grains can do that. People are under the impression that you take white rice and then make fermented porridge and you are going to be okay. Please do not do that unscientific thing. And many people think curds is probiotic. That is not at all. It is actually a lactobacillus anaerobic bacteria. You need aerobic, diversified gut microbiome to cure any illness on this planet, because it and it only can make vitamin B12. The gut microbiome is the one which makes vitamin B12 in all living animals. So you have to make your own B12, not eat salmon or eat brain of monkey or liver of bear. So you want vitamin B12 and many more transporters, regulators, including the so-called gut-brain axis, depends on the gut microbes. So unless you enrich your celiac region with gut microbes, no disease can be healed on this planet Earth in any human being. So they may seem to help you by giving artificial these things, but it is not permanent, it is not sustainable. So to make it sustainable, what all you need to do is take 5 grams of these wonderful enriched grains: kodo millet, foxtail millet, barnyard millet, brown top millet, little millet. These 5 grains have got 8%, 9.8%, 10%, 10.1%, 12.5% enriched fiber in its grains that can happily grow your microbes. So soak them just 5 grams in 500 ml of water in a mud pot, because mud pot alone has got micropores that make the oxygen come into picture. So you soak them for 8 hours. Why do you need to soak any millet food before you cook? The grain has the fiber, fiber has to be hydrated. And that was our wonderful method. All over the world, the ancestral kitchens used to soak their grains. Now we don't want to soak. Put it in pressure cooker. 2 minutes. I want to be able. 2-minute noodles. eat your 2-minute noodles, in 2 minutes you will go to ICU. And that's what is happening. Without fiber you are eating food, without fiber you are not able to even go to the stool. So, the whole modern world, again, taking isabgol and then drinking in the night because they want to shit. And sadly, I don't have time. Despite that, I want to show that we are supposed to eat in Sukhasana and we are supposed to shit in Malasana. This is as simple as that. But now we are eating and shitting in the same posture. This is the problem. These have been prescribed in our Ayurveda systems long ago. So we have been flouting all the Ayurveda rules and talking about Ayurveda. So your medicines, everything appears around you. So all these rules have to be followed if you want to be healthy. So do not eat the foreign food. Do not eat the processed food. Do not eat the food that doesn't assist to grow your gut microbes. So millets is the gold mine for health. Nothing else can satisfy the definitions of food that have been prescribed in our ancestral books. So I think I will stop here. I have a lot more information. I have been working for last 30 years and no one need to be afraid. You can just take the books, no copyright, no copy left, no patent, all free downloads. You can go back to your kitchen and cure your diseases. As simple as that. As simple as that. Type 1 diabetes, don't care. Gangrene, don't care. Maximum 3 months to 1 year. Any disease can be tackled in your kitchen. Are you ready to change your food? You can change life on this planet. Thank you very much.
Good morning to you all. Sir, it was a fortunate and a blessing for us. You are here with your thought of millet as a gold mine. Dear friends, as you all know, food is the ultimate for us. And many of us will live to eat food. But when food has been taken in the right direction, and sir, when he mentioned about food is nothing but which maintains the homeostasis, that is the right food what we take. And sir has highlighted the importance of millet, which is alternative to the rice, and he said where we can restore the sick to health. That is the most mission of the every physician. We treat diseases, but more than that, we have to restore the sickness back to health through our system along with the medicine. On this occasion, I just thank you, sir, because this time was not enough for you to give your valuable thoughts for all of us. Still, you have given a glimpse of about it. Thank you on behalf of Ayush Haвва. Thank you.
Thank you, sir, for your valuable inputs. Now it's time to honor our today's speaker. I request Dr. Zainuddin, Treasurer Ayush Haвва, Dr. Gopal Krishna Nayak, Treasurer Ayush Haвва, and Dr. Krishna Gokhale, sir, to kindly move on to the dais and honor our speaker, Dr. Khadar Valli. I request them also to honor our chairperson, Dr. Sandeep Bekal sir, and co-chairperson, Dr. Roshan Pinto. Thank you, dignitaries. Thank you one and all. Here we wind up the scientific session. We shall soon begin with the felicitation program. I kindly request all the audience to stay back.